Dr. Baxter is a clinician scientist working at the intersection of ophthalmology and biomedical informatics. She's an associate professor of ophthalmology and biomedical informatics here at UC San Diego, and which is kind of cool that we even have those joint appointments between ophthalmology and medical informatics. She's also the chief of ophthalmology, informatics, and data science at UC San Diego, chair of the American Academy of Ophthalmology Data Standards Work Group, and a member of the AAO Committee on Artificial Intelligence. She is the founder and co-lead of the Observational Health Data Sciences and Informatics Work Group in eye care and vision research. She has expertise in artificial intelligence, biomedical and clinical informatics, big data analytics, and data standards, with a particular interest in promoting diversity, equity, and inclusion in clinical practice, in research, its application, and in training. She is the first nationwide ophthalmologist to receive the National Institutes of Health very prestigious Early Directors Independence Award, which she received in 2020. And today, Dr. Baxter will be talking about AI and the eye, transformative research to fight blindness and save sight. And we all want you to be very successful in your work. Welcome, Dr. Baxter.
Thank you, Dr. Picasa, for the very kind introduction, and thank you to you all for taking part of your weekend to be with us here today. I'm delighted to be part of this program. So I'm going to talk about AI in the eye, but also about AI in healthcare in general. There's a lot of excitement around how artificial intelligence is going to transform healthcare, and you may have seen this in the news or maybe even experienced it yourself as you go through the health systems. We have so much more data to work with now than we did say 10, 15 years ago. We used to use paper charts to do all our documentation. Now that's largely been replaced by electronic health records and sort of this digitization of medicine. And that's really given this wealth of data to work with. And the goal really for all of us in medicine is to say, how can we leverage that data? How can we use that data to make patient care better, to make outcomes better? But on the flip side, we know that it's a really challenging prospect as well, right? The healthcare delivery, the practice of medicine has always been very complex. We're balancing a lot of different conditions, and also that there's a very personal human aspect of the physician-patient relationship. I think there are concerns about how will AI affect that? Are we using AI in a fair way to make sure that we're not worsening health disparities? So a lot of open questions, a lot of exciting areas for research and investigation, and as Dr. Picasa mentioned, being curious about those various aspects. I just want to take us back to, what it used to look like, right? When we think about how we're going to do things in the future, sometimes it's helpful to look back on what has been and what we were doing historically. My alma mater, unfortunately, was not UC San Diego. I actually did medical school at the University of Pennsylvania. And there was a very famous American artist, Thomas Eakins, who was commissioned to paint a number of paintings that actually hang in the halls of the campus and the Philadelphia Museum of Art. But he's well known for paintings of surgery. I am, in addition to being a researcher, I'm an actively practicing surgeon. Just did surgery yesterday and saw some post-ops this morning, actually. Before coming here. But you can see that surgery looked very different. These are from the 1800s, and even in the span of a few years here between the two paintings, we've seen adoption of the white coats and some semblance of antiseptic technique. Critics of this, art history critics have also noted the inclusion of a professional nurse and development of anesthesia. Let's fast forward to what things look like today. This is an operating room at the Shiley Eye Institute where I work, and it looks very different than what surgery looked like in the 1800s. And not only do we have a totally antiseptic technique now, anesthesia, we have video monitoring, we have a lot of different data feeds, we have several different monitors that look at the patient's blood pressure, heart rate, oxygen saturation during the entirety of the time that we're doing surgery. So many channels of data and information coming through, and very different than what it looked like 100, 150 years ago. So, what's special about ophthalmology? Not everybody is familiar with this field. It's maybe one of the more niche fields of medicine, but we are essentially a field that is concerned with medical and surgical management of eye health and diseases of the eye. And eye diseases have a huge impact on quality of life. Think about everything that you're doing today that requires your vision, driving, watching TV, looking at your phone, all these things that really depend on sight. It is, some might argue, and I'm certainly biased, that it's the most important sense that we have. And there are studies that have shown that people fear losing their vision, or some people fear losing their vision more than they fear heart disease, cancer, and in some cases even death. So it's really a privilege for us in the field of ophthalmology to be working on these conditions because people do prize their vision so highly. As I mentioned with the surgery example, in clinic too, we have so many more data inputs now than we used to. So not only are our clinical notes digitized and now available in large volume in a form that they weren't before when we were on paper charts, but we've also had an explosion of technology. So these are just some examples here of different imaging technology, testing technology, looking at different aspects of anatomy of the eye and how it's functioning that we didn't have decades ago. And a lot of these are very specialized data that require a lot of training to adequately interpret and understand. And there's a lot of demand. We have a whole baby boomer generation that is entering the age range where eye diseases are common. A lot of our eye conditions are age-related. And so there's a very high need to treat eye diseases across the population. And we may not always have enough eye care experts in every part of the country or the world to be able to meet that demand. And so I really think that this sets up a lot of opportunities for AI. How can we use AI to bridge that gap and try to provide better access to care and help with interpretation of all that data to try to achieve the best outcomes for the most number of people? I'm going to describe two different common eye diseases. One is diabetic retinopathy and the other is glaucoma. Now, diabetic retinopathy is the leading cause of visual impairment in working age adults in the US. And we're seeing a lot of it because diabetes as a condition overall affecting the body is so common. The good news is early detection and treatment can preserve vision and prevent blindness. Unfortunately, when we do see patients who have not had good access to primary care for their diabetes management, or they haven't had good access to eye care, they can often come to our emergency departments and have these end-stage complications and go blind from their diabetes. And it's really hard at that late stage to be able to reverse the vision loss. So early detection is really important. Now, we have multiple professional guidelines that recommend regular diabetic retinopathy screening. That's where you get an eye exam and we can see whether there have been changes from diabetes in the eye. But we have a lot of gaps in implementation, right? Like I mentioned, there are places in the country where there aren't enough eye care experts to do all those eye exams, or we have places where the burden of diabetes is incredibly high, and there's just not enough, appointments to see everybody. And I don't know about you, I'm sure everybody has experienced the difficulty in getting into some of these specialty appointments and long wait times to get into the health systems, even here in a big city like San Diego, let alone in a more rural area where you might not have as many doctors. So the solutions that we as researchers and also as clinicians are looking at include, how do we expand these screening efforts beyond eye care clinics? Can you get screenings done in primary care settings with your endocrinologist when you're doing a diabetes evaluation anyway? Is there a way we can use AI? And the good news is that this is one of the most mature implementations of AI in medicine. And in fact, we at UC San Diego have started a screening program in 2020 and have screened over 3,000 patients to date outside of our eye clinics. So this is in our primary care spaces, endocrine clinics. And this required a lot of work around how we get that data flow and data management to work. And in fact, an AI algorithm that automatically detects diabetic retinopathy was the first autonomous AI model to be approved by the FDA in all of medicine. So this this is something our field is very proud of, and it is in operational use right now. Another disease that I've worked a lot in personally is glaucoma. And this one's tricky because you don't see changes early on because it can affect the edges of your vision first. And so it's not always very noticeable to patients when they have changes because it's quite insidious. It's not always obvious, and there's not always pain or pressure or other symptoms to notify that there's something going wrong. Our department at UCSD has been a world leader in AI for glaucoma, and I've been very fortunate to work with many of these colleagues in looking at different aspects of the disease and how we might identify people who are at risk for developing glaucoma and their glaucoma worsening. And one of the most exciting things is we're trying to take that from a research environment and bring it to the point of care in clinical environments. And UC San Diego Health has been a leader in developing systems for enabling point-of-care AI implementation. We've already enabled AI models to be working for helping to look at sepsis in the hospital, to help our primary care doctors with handling increasing volumes of documentation burden. And the glaucoma model is another place we're actively working on to bring that to help with day-to-day patient care. Very fortunate to have support from Andrew Viterbi and the health system. We're building a Viterbi Family Vision Research Center. If you go across the highway to the health campus, it's actively being worked on right now and anticipated to be done in spring of 25. And this will really be a hub for us to continue this kind of research and understand AI in the eye and in healthcare. I'll go over this briefly just for the sake of time, but we are partnering with other UC systems to build these big data repositories. One example is the UC Health Data Warehouse, where we have data across the entire University of California, and really those numbers and the training data that's needed for AI models is really enhanced by bringing together data from all across the University of California. We're also very active in working with the NIH All of Us research program. Again, another big source of data, including healthcare data, with an emphasis on diverse populations who have been traditionally underrepresented in clinical and biomedical research. And finally, we're part of a multi-center initiative, again funded through the NIH, to create data sets for future AI models in healthcare. This one's focused on diabetes. So I'll just end with this. That not only are we creating AI models for the eye and eye disease, but there's also a lot of excitement about using the eye as a tool for other parts of the body and for healthcare in general. You might have heard the eye is the window to the soul. Well, the eye is also a window to the rest of the body, and we can use very quick, non-invasive examination techniques and imaging to look into the eye, look at retinal vessels, and we've done research to show that you can actually predict stroke, heart disease, neurological disease, endocrine and autoimmune disease, and all these other areas by looking at the eye. And so there's a lot of movement in the field to basically use the eye as a way of improving healthcare delivery overall for a number of systemic diseases. And I think that's a really super exciting part of what we do. So thank you so much for your attention. I just want to give a quick shout out as well because it's Veterans Day weekend. Thank you to all our veterans and service members. My husband's active duty Navy, and we actually just came back from a 2-year overseas tour of duty in Japan. I'm very grateful to the university for letting me continue this research and my faculty position while we did our part for the country. But I appreciate everybody being here today for the Veterans Day holiday as well. Thank you.